Hi, I'm Matthew Herzberg, and this is the Myopia Mindset. This is your weekly check-in for motivation, inspiration, and education on your path towards success with myopia management. And speaking of education, this continues our Road to Vision by Design 2025 series, where I am highlighting some of the more noteworthy lectures and speakers that you should keep an eye out for on your way to the conference. You can find out more information about Vision by Design at aaomc.org. It's taking place in late October, starting on the 22nd. It's the Super Bowl of myopia management, and it's the meeting you need to attend if you are doing orthokeratology or any form of myopia management. And for this episode, I've got two absolute legends of our industry. I'm super excited to have them on the podcast. I have Dr. Michael Lipson and Dr. Bruce Koffler. Dr. Michael Lipson is an ortho-K pioneer. He's a myopia management expert. He's the author of Contemporary Orthokeratology. He spent decades pushing the boundaries of specialty lens care and continues to shape the future of vision correction. And Bruce Koffler is an ophthalmologist with over 40 years in cornea and contact lens care. He's a longtime leader in ortho-K, a global lecturer, a former president of CLEO. And might I add, Dr. Koffler was instrumental in the connective tissue between ophthalmology and optometry for myopia management. Gentlemen, welcome to the podcast.
Thanks for having us, Matt.
Yeah, thank you.
All right. So before we get started, because I'm super excited to talk about your lecture and everything that went into it, if anybody has any questions for you two about whatever we talk about in this episode, how can they get contact with you? Michael, we'll start with you.
You can use my email at mjlod77@gmail.com.
And Bruce?
Also, my email is B as in Bruce Koffler at AOL.com.
Excellent. And of course, if you love what we're doing here at the Myopia Mindset, please consider becoming a paid supporter of the podcast. You'll get early episodes, tons of bonus content, and now that can be found at myopiamindset.com. All right, gentlemen, the lecture at Vision by Design, myopia management, risk assessment, and treatment protocol. When I saw this lecture on the agenda and the description for it, it reminded me of everything that you've been doing up to this point, and all the hard work you guys have put into everything that's coming into this lecture, the protocol, the digital risk assessment guide, all of it. So let's start out with a brief overview of the lecture and what people can expect from it, and then we'll go into the background. So, Michael, why don't we start with you?
Well, basically, it's in two parts, as the title suggests. Bruce and I developed a risk assessment guide for busy practitioners to use to help them, whether they are new to myopia management or whether they've been doing it for some time. And during the course of a busy schedule, we found that it was very helpful to have some kind of a guide, an outline, to help practitioners both in the prescribing as well as demonstrating to parents, and also as a learning tool for staff, what goes into creating risk of myopia or high myopia. The second part of the lecture takes all that information from the risk assessment, categorizes the level of risk, and then recommends a treatment protocol for that specific child.
Right.
So, Bruce, you want to elaborate on that a little bit?
Well, I do in a couple of ways. And Michael and I are kind of unique in the sense that we both had busy clinical practices throughout the day. So we understand what a busy clinician has to do and some of the things that can go wrong during the day and some of the things that can fill your brain so that it's hard to focus on the patient. And we also are unique in that we are researchers and that we have participated in many clinical research designs, and we keep up with the literature very closely. So with all of our years of doing all of this, we felt like this was perhaps an opportunity to bring that all together, bring the researchers and bring the busy clinicians together with something easy for them to follow. This guide that we will be kind of generally explaining and then outlining more at the meeting is there so that people don't make mistakes in a busy day. They can assess the child, and it is a perfect thing to explain to families what's going on. And I think that's really valuable to have. Some of the charts we have already are good, but I think this will also, this risk score will bring it out to the family why they need to move ahead with a certain myopia protocols.
Yeah, and in the description it says there is an unmet need for a guide, and I completely agree with this. I've been in so many practices over the years where they don't have time, they don't have the resources, they don't even know how to talk about all of these subjects in their practice. So I think it's really interesting, and I'm surprised this hasn't been done sooner. I think it's really interesting that you guys put together this whole package in order to figure out how can we streamline this process essentially, and then make it accessible and resourceful for the family, for their child, to streamline this process. So let's start at the beginning. What was the inspiration behind it? Obviously, you said you both have busy clinics and you have a background in research, but how did you guys come together in order to get this whole process started?
Well, if I think jump in on that, Michael, because I was the one who contacted Michael on this. I was kind of daydreaming of what can be done because we're getting more complicated in our protocols and what we can do. The literature is being filled almost daily with new reports. We have conflicts with what percentages of atropine we should start with or not start with. And there are new people coming on board, as you mentioned. There are new practitioners who are now becoming more interested and realize that myopia needs to be addressed in a child. And so in the past, when I've been in my office, in my clinic, I used to depend sometimes on what I would call a little pocket guide. And this would be a little cheat sheet, if you will, that told me that this one converts Snellen numbers into metric. So that was always kind of confusing to me, but with this little guide, it was not at all confusing. I also had one for uveitis care, because when you have a uveitis patient, you have to order probably now 10, 15, 20 different blood tests. And you didn't want to get just half of them, and you didn't want to necessarily have to go to the book to figure out what to order. But if you had it in your pocket, it was there. So I thought, well, is there a possibility that we might be able to work on something like that? Because again, we understood both sides, the busy clinician and, if you will, the researcher and the people who are doing the writing. My initial approach was to call a couple of ophthalmology colleagues, and to be honest, Matt, they kind of poo-pooed the idea. They said, oh, it's so changing and there's so much conflict and stuff like that. And I said, well, conflict, we've got to treat these children. I mean, there's no conflict with that. And so my next step was to call this very talented young writer and researcher, Michael Lipson, who we've done a lot of writing in the past. Michael said that we started around 2016 writing articles for both ophthalmology and optometry journals, and for pediatric ophthalmology, he asked us to do a great summary article. And he's been a very sage and gentle spirit, but so talented. So I called him, and I fully expected him to say, oh, Bruce, it's kind of not really a worthy project. But instead, his eyes lit up and his voice lit up, and he said, I think there's something in this. And I said, well, Michael, how about you getting to work on this and start to develop it? So with that, I'll turn it to Michael, because next phase.
I think, we kind of took this idea of the pocket guides and said we both use them in our own clinic and keep them in our lab coat and refer to them regularly. And so we started developing something like a pocket guide for myopia management, but then we were kind of slammed in the face with kind of bringing this into the 21st century and calling it and making it a digital guide. So it would be more accessible to doctors in electronic format as well, if they preferred that. So it could be available either way, digitally on the computer, on their iPad, on their EHR, any way that it could be accessed. We wanted to make it available that way. But essentially, the guides that we use are very helpful in the clinic. And with myopia management, we see articles published almost daily now about efficacy of one modality versus another one. But we've not really seen established protocols, how to use them. For example, we know that atropine higher concentrations are more efficacious than lower. It's almost universal now. But how to do it, when to start, all those things are unknowns right now. And for a doctor who is just getting into this, we said, well, we have to establish who should be treated, when they should be treated, and what their level of risk is. All the factors that go into this. And it's hard for a doctor who is running a busy practice to keep up with everything that's going on. So we wanted to make this accessible, an updatable type of a program that we can make easily accessible for the doctor.
Yeah. And so where did you start once you guys had come together on this? What was the first step? Did you, as far as the study is concerned, who are we referencing or resourcing for the study? Like, where do you begin?
Well, it's just combing through the volumes of literature that's out there and finding the most credible, the most highly cited studies, and the ones that are I guess the most reputable is the best way to put it, that really have been tested over time and find that they are high quality studies, and showing the efficacy of these programs and what factors really go into creating risk and getting the bang for the buck on the treatment. Essentially who we should be treating and how we should be treating them. Right. It's through studies, highly cited, published studies in very well recognized journals throughout the world. So
if I can just jump in to mention that Michael and I have attended probably almost every AAOMC annual meeting. And let me just say, from an ophthalmology standpoint, I wish more ophthalmologists would come to that meeting, because it is the best meeting for ortho-K, for sclerals, that combination of sophistication. And so we've listened through a lot of lectures in the scientific sessions and in the workshop sessions. And so we're in a kind of an ideal situation of having a really good feel of the good literature. And so Michael is saying he had to, go through it very carefully. Well, it's on his brain too. So it's not, it was fun to kind of update everything, but, it was fun for us to kind of get on calls. We had multiple calls in the beginning, just throwing ideas of how to get started and throw an outline together and then develop that outline, from there. At one point, however, we did not have the concept of a score. And I said to Michael, I said, when I go see my internist these days, they have a risk assessment score for my heart. They have a risk assessment score for stroke. They have a risk assessment score for diabetes. well, you're not old enough to go and get your Medicare annual exam, but when you go to do that, they're looking for that, also looking to make sure you're psychologically, can remember things. And so numbers are put down and a total score is given for like stroke or cardiac. And I said, well, hey, is that possible? And he goes like, well, let me work on it. And before you know it, he's coming back with ideas on what other people have done in other fields and adapting it to the myopia. And that's how we got our myopia risk score. And also, Mike, why don't you talk about just in general the attributes that you have put into that risk score?
Okay. Before I get to that, one other thing you just brought up, it was great because we, in the literature, we see all these risk scores and we've experienced it ourselves relative to cardiovascular risk or diabetes or stroke, like you mentioned. But in the eye care field, what's the most common score that people are looking at is something really readily accepted now is the OSDI, the dry eye score.
Yeah.
And basically, doctors are using this in their office. It becomes really, really commonplace now in the dry eye practice and in the literature. So we said, well, if there is such a thing in eye care, there should be one for myopia too. So basically, in searching through all the literature in assessing risk of high myopia, we came up with these 7 attributes. And just to highlight those 7 attributes would be number 1, ethnicity, the gender, male, female, age of myopia onset, parental myopia, and then hours per week that are spent outdoors, hours per week that are spent on near tasks, and finally the baseline axial length. So those 7 attributes, each one is given a score. And we basically went through significant amounts of literature to find what is the risk for each of these attributes and to score them appropriately for each child. So each child who is in there gets an individual score, which is myopia risk score, MRS, as we've abbreviated now, that will assess their level of risk for developing high myopia.
Yeah, I love it because this is something that industry definitely needs, no question. My question is, though, how did you come up with the scores? Like, let's take outdoor time, for instance, because a lot of, especially new to myopia management docs, really struggle with how much recommended outdoor time that they should communicate to parents. They really don't know what a good number is. Like, we all know kids need to go outside more. When I was a kid, my mom was like, hey, go outside, don't come back till lunch. And then she fed me lunch and sent me right back outside again and said, don't come home until the streetlights come on. So, like, but we're in a different world now. How did you guys come up with an assessment for, let's say, outdoor time in order to create that number?
Again, it's combing through the literature.
Mm-hmm.
And there are individual studies that have been done on this. And then there are these review articles, meta-analyses. So for each of these attributes, I don't know, there's maybe a dozen studies that have been found to be well-done studies, well-controlled. And, putting all those together, say, well, there is a certain number that we come up with. And generally, not specific for everybody, but in general, we also know, before I tell you this number, I wanted to tell you that hours outdoors seems to be very, very effective in delaying the onset of myopia. But the literature relative to the hours outdoors, once somebody has become myopic, is a little more vague.
Mm-hmm.
But in general, if you have a pre-myopic child with a lot of other risk factors, generally we're looking at about 2 hours a day or 14 hours per week of outdoor time being recommended.
Yeah.
If I can jump in a little bit here, Matt, we realize that, there are arguments and just about, or discussions, heated discussions sometimes. But I would say that everything Michael brought up in the literature, I've heard in lectures from some of the excellent speakers that we have at AAOMC. So it's not anything that was, really out in left field. It was really general consensus as of now. The beauty of this guide is it's digital, and it's going to be so easy to manipulate and update. And we realize that this field is moving so fast, and we hope that if accepted the way we think it's going to be accepted, we'll be able to, if there's a major change, let's say in time outdoor, someone really comes up with a major review article or meta-analysis that's better than what we have now, we'll be able to incorporate it immediately. Number two that I wanted to just mention is that we soul searched where to publish this.
Mm-hmm.
And, we've all been through the major journals and stuff, and they're excellent. And by the way, there are some excellent review articles on, the when to diagnose myopia stages and then where to take it. And they're very complicated tables and graphs that they have in these articles, and they're very long. And my general assessment of that is, I'm not going to read that kind of thing. And it's even if I printed out the table, it still is a very complicated thing to look at. So we wanted to make our guide something that would be easy. And also in terms of the publication, we thought that putting it in a publication that came out like Myopia Management
Review of myopia
would be great.
Yeah.
Myopia Review. Let me make sure I got that right. Would be great, and that there's a story to that as well that we probably should tell. But they were very, very excited about helping us, and they get out things rather rapidly. So any kind of update that needs to be done, if they're willing, can be pushed out, within a week, if necessary.
Yeah. You mentioned AAOMC. Did you guys go to the community we've got so many docs who have been doing ortho-K myopia management for years. Was there any part of that influenced your guys' work, because you have this great resource? I mean, maybe most of it's anecdotal. I can obviously see why you want to start with the science, with the studies, with the research. That's the foundation. Did you guys go to the community? We've got so many great docs who could give you insights into your system.
I will say that I have spoken with colleagues, not about specifically the guide, but specifically about what their philosophy is in practice. How do they do it? And in talking to people, if I mentioned the possibility of what would you do with a guide? Would you have a guide? Would you be helpful? Would that be helpful to you? And they said, definitely, it would be helpful. Even though I'm experienced in this, I get a feel for it for each patient, what's going to be best. But to actually put something in writing and an outline format of at least trying to give somebody some help in terms of establishing a foundation for what their overall philosophy of myopia management is. Mm-hmm. And I think just in talking with people, that's how we came up with the idea that there was a need for something like this, and there was nothing out there like it.
And it makes me wonder, for eye care professionals who are new to myopia management, like, what is the most important first step in integrating your protocol into their daily practice?
Yeah. Maybe, Mike, I can jump in on that. I think is to get your staff organized with it. I loved having an educational staff. I was very dependent, and I was able to do things like contact lens work because I was doing the ordering, and then I was turning it over to a very capable contact lens coordinator, or really I had some very capable optometrists working for me as well. And together we worked as a team, and it was great because it cut down my time. Anything that cut down my time with the patient, yet gave me the quality time I needed with them, was a big bonus. And I think that this is so easy to be done. These 7 attributes can be asked by the technician and organized for the practitioner, so that when they don't have to waste time asking, well, who's myopic in the family, or how many hours a day are you outside playing, that will all be taken care of. So, doing a little team building ahead of time would be great. I think the staff will now also be integrated into the myopia system, the concept of the whole thing, because they're doing something important, as well as collecting the data like refractions and stuff. And I know everyone's office is a little bit different, but I needed help, and I got my quality help from training and teaching my technicians really well. And then the good technicians would train the new technicians, and it worked together just beautifully.
Yeah.
I think you bring up a great point, Bruce, because of the fact that in a number of other surveys that are done about myopia management, or specifically on Ortho-K, one of the things that comes up is, what's the biggest obstacle to a doctor to initiate myopia management in his practice, or to initiate Ortho-K, or even other modalities of myopia management? And one of the biggest obstacles seems to be time, because the doctors feel like, well, they have to move on to the next patient, when the parents have tons of questions. It takes a lot of time to answer all those questions and to say, well, this is something new. I've never heard of this before. So you can get a lot of support from your staff before they're even entering the exam room. And again, afterwards, if you have a myopia management coordinator in the office, it's very helpful for them to go through all these questions, so the doctor is more available to more patients. So,
yeah. And I'm excited to see where it goes. I'm definitely going to be at your guys' lecture. I can't wait to hear it at Vision by Design. And we'll close on that. You should definitely be going to Vision by Design. AAOMC.org is where you go to register for that event. Guys, let's close with your contact information again. If anybody wants more information or wants to get in touch with either of you, Bruce, we'll start with you. How can they do so?
Yeah, just reach me by email at B as in Bruce, B Koffler, Koffler, at AOL.com.
Yep. Yeah. And Michael.
And I would welcome any emails or questions at my email address of mjlod77@gmail.com.
Yeah. And the session is going to be on Saturday of the event, Myopia Management, Risk Assessment, and Treatment Protocol. Definitely check this out. And just a quick note, if you're enjoying this episode, there's actually more waiting for you. We release extended versions of every episode that we do. We do exclusive bonus content for our paid supporters of the Myopia Mindset, stuff that you won't find anywhere else. It's just $12 a month, which is about the cost of 1 cup of coffee each and every week. And it helps support the show, bring on great guests like Michael and Bruce, and keeps the conversation about myopia management growing. And if that sounds like something you'd be into, if you would buy me a cup of coffee every single week to nerd out about myopia and have on great guests like Michael and Bruce, then please consider supporting the Myopia Mindset. You can do so at myopiamindset.com. We thank you very much for your support. Michael, Bruce, guys, thank you for so much. Thank you for your contributions, your continuing contributions to our industry. Like I said, 2 absolute legends. I want to have you both back on to talk about your amazing careers and what your vision is for the future. So I hope you'll consider coming back on to the Myopia Mindset in the future.
Glad to do it. Thanks for having us, Matt.
For sure, Matt. And thank you for doing what you're doing and bringing this to our care practitioners' computers and right directly to them. Thanks.
All right. Yep. And for everybody else, we will see you at the next one.